Okay, guys. It's March 31st. It's about 8:20 in the morning. I wanted to go backwards a little bit and talk about the purpose of the heart valves. I know we talked about the anatomy, but I don't know if we got to talking about really what the purpose was. And you see that first bullet there. It is to allow blood to flow in one direction and prevent backflow. When we do have a problem with the valve, and we'll talk about that maybe later, we have what's called a heart murmur. Sometimes we can grow out of them, sometimes we can't, sometimes we have a valve issue that we have to replace, and we may talk about that a little bit later, but I wanted to go over that before we moved on. We've talked about the valves and the different grade vessels, so I wanted to go backwards there for a little bit. Make sure that you know the layers of the heart wall. I think we did get to this, but I'm not sure in every class. I know fifth hour was a little bit behind, so make sure that you know those three walls of, excuse me, three layers of the heart wall. The epi is the outside, myo is that big thick muscular layer, and the endocardium is actually the layer that's going to touch the blood inside the chambers. I know we talked about blood circulation in the pulmonary versus systemic unit, circulation or circuits, so I'm going to move on from that. And I think the first thing that you had on your notes from yesterday or today, I can't even remember, is coronary circulation. Remember, the heart pumps blood to the body, but remember the heart itself needs circulation as well. So we get that through the coronary arteries and the cardiac veins. They're also called coronary veins. So the blood is going to empty from the heart itself. You know, the heart needs nourishment, the cells of the heart need nourishment as well. So that blood is going to empty into the right atrium through what's called the coronary sinus, as you see there. And it kind of merges with the superior vena cava. Okay. I did send you a video. Not sure it's working very well. So if you just search heart conduction system on YouTube, you will find some really good videos. I just wanted to make it a short one, and there's no talking in the one that I sent. It's very, very easy to see. So we'll talk about the nodal system and a little bit of special tissue that's actually nervous tissue that's built right into that right atrium. And that actually is called the intrinsic conduction system, and it starts with the SA node. Okay, so this right here is something you're going to need to know. So the sinoatrial node is where the whole conduction system starts. And again, you need to look at that video. It's easier than me just pointing to it. But the SA node is going to be right about here. This would be the right atrium. This is also known as the pacemaker of the heart. It's going to conduct and send its conduction signals to about right here where the AV node is going to be. It's at the, as you see, the juncture of the atrium, or the atria and the ventricles. Then it's going to go down here into what we call the bundle of His, okay, which is it would be about right here. Then it's going to split into our right and left bundle branches and then deflect from the apex of the heart up the walls of the ventricles as what we know as our Purkinje fibers. So if I was to ask you a question, and obviously I won't be able to, but I would ask you the sequence of events or the heart conduction system sequence, and that is on this slide right here. Okay, watch the video. It is very good. It'll show you how it works. So please don't be afraid to watch that video. So the contraction of the heart itself is initiated by that SA or sinoatrial node, which is going to set the heart rate and heartbeat. So these different nodes have what we call autorhythmic cells within them, and they are going to cause the actual SA node to send the signal. Okay, and as the impulse travels to the different bundles and the nodes, the contraction is going to be passed along. So when our atria contract, the ventricles relax. When the ventricles relax, the atria contract, and so on. And that's what causes our heartbeat. Okay, I think we did this in vocab. I'm not sure if we did or not, but these are the two abnormal heart rates that you should know. Tachycardia is a rapid heartbeat of more than 100 beats per minute. That is really rapid. And remember, these are resting heart rates. Bradycardia is a slower heart rate, and that is less than 60 beats per minute. Although I think in class we discussed that you could have a low heart rate if you are a well-trained athlete or, you're just in shape. And usually younger kids your age have a pretty low heart rate. the average heart rate in an adult is 72 to 75 beats per minute. Okay, and I'm going to stop there. We'll talk a little bit about the cardiac cycle later. I wanted you to hear my voice, and I'm really looking forward to hearing some voices later on Tuesdays and Thursdays. From 12 to 1, I have a Zoom class open, so a Zoom call open, I should say. So if you guys want to talk, feel free to just get the Zoom app. It's free. All you have to do, I put the code, my code of my call in a message that I sent yesterday, so you should have that code. Keep that code, and you just have to join. You have to make a name. Please make sure it's appropriate, and make sure the background that you're going to have is appropriate as well. Don't make sure you're not like in the shower or something silly like that, okay? All right, talk to you later, guys.